Hi folks, it's Dr. Mike and I'm here again, and this time I want to talk about medical exercise training systems. Now we've talked about the medical exercise specialist mindset, we've talked about the future of medical exercise training, we've talked about a lot of things. But now I want to talk about medical exercise training systems. Now it's a Saturday, I'm here at Medical Fitness Pros in Houston, and as you can see in the background, there's no one here today, okay? We had clients earlier today, everyone is gone now. So I wanted to come over to the facility and record after everyone is gone to talk about the systems that you have to have in place to run your practice. Whether your practice is a solo practice, you're going to clients' homes, you're contracting into a gym setting, you're an employee in a gym setting, you're working in a physical therapy or chiropractic clinic, regardless, you still have a practice. And that practice requires certain systems. Now, as you know, I've been a physical therapist now for 33 years. For probably, I guess about 19 to 20 of those years, I was in private practice. I had my own physical therapy clinics. And in the beginning, folks, I was an excellent therapist. I mean, great. I had gone to advanced training programs. I had a master's degree from Michigan State in the osteopathic program. I learned how to do muscle energy and myofascial release and craniosacral therapy. I had gone through the Institute of Graduate Health Sciences. I had done all of their joint mobilization and high velocity thrust courses. I had traveled abroad and done training programs around the world. I had done residencies at some of the better physical therapy and rehab facilities in the country. And I knew how to treat everything as a physical therapist. Well, I decided I was going to go out in private practice. And folks, the first several months of that was a disaster. I could treat the patients, I could get the outcomes, I could make them feel better. I was getting miraculous things done. But folks, I was a hot mess when it came to managing the billing and the scheduling. I couldn't get any documentation done, which meant I couldn't get any money because the insurance carrier required that. I was broke and I was a hot mess. Well, the guy that was my mentor when I went through PT school, he took me under his wing. He came by my office one day and he just heard all kind of crazy things were going on, and he sat me down one day and he really said, what is it that you're doing? This isn't about just simply the outcomes that you're getting, it's about managing the practice and having systems in place. Now, that's for physical therapy. As you know, I'm a physical therapist, but I've been in this medical exercise training space now for 24 years. We started the MES program. So I understand where you are. You're a fitness professional, but you're managing medically based clients, which means you no longer adhere to the standard fitness guidelines. Sign them up, and your metric is how many client sessions you have per month. Now your metric, or the measurements you're looking at, are based on the functional outcome measures. Are the clients getting better? And then, are you developing referral relationships? And then on top of that, you also have to look at the amount of revenue you're generating. But now you've got a couple of extra factors there. You now have outcome measures communicating with the medical community, which means you got more things on your plate, which means you better have systems in place. So we call these medical exercise training systems, probably a better term would be medical exercise management systems. And we've shown you these systems. I've got them listed here. These are the essential 9. There are actually 12 in the overall package, but I'm just going to talk about the 9 essential ones here. Now, we're here at Medical Fitness Pros. As I said, it's a Saturday afternoon, and I decided to come in and shoot this segment on Saturday to really kind of give the idea of this. My mentor told me that you build your clinical skills from 9 to 5, Monday through Friday. But you build the actual practice itself after 5 o'clock, Monday through Friday, and on the weekends. And what he was saying was, hey, when you're actually in there working with the individual clients, producing the outcomes, that's making you a better clinician. But after hours is when you sit down and you look at the documentation, you look at the marketing, you tweak all the systems, you do all the things on the website. That occurs after 5 o'clock, once everyone is gone. And that occurs also on Saturday. So I wanted to come in on a Saturday to say, hey, this is part of the process so that you now build something that's sustainable over a long period of time. It's not just about you, because that's the problem most medical practitioners make. And I'm not saying you're a medical professional. What I'm saying is, in this realm of healthcare and wellness, we make it about us. It has to be about the systems. And I know everybody comes to see you. Folks, I had to learn the hard way. You better put systems in place, because all of us dream about the day that you're in Hawaii on the beach, drinking a nice cool one, and you call back to the office and everybody's doing everything. Well, you got to start now putting the systems in place. And I learned this early on. So let's talk about these real quick. Operations. An operations system means everything from A to Z with regard to running of the facility. That means maintenance, that means cleaning, that means equipment upkeep, that means purchasing equipment, that means resupplying the bathrooms, that means what is the cleaning crew that comes in and cleans the facility? When do they come? That means also any licenses that are necessary. That means having a security system. That also means if you have client information on your premises or in your possession, if you're a solo practitioner, which you will have, are you putting that information under lock and key to protect the client's privacy? Social security numbers, addresses, things of that nature. So when we look at the idea of operations, you've got to have something in place that looks at all aspects of the physical plant of your practice. Whether you have a facility like this one or your practice is literally out of your car, how do you manage all of that? You got to have a system in place for those. Example, how often are the treadmills updated? On top of that, well, okay, if you're a solo practitioner, well, how often are you having your vehicle inspected? Do you have the proper registrations for your vehicles? And more importantly, do you have the proper insurance to actually go out there and provide the services? Now, I'm going to skip medical relationships here and go to client management. Now, client management is the biggest system you have. Client management deals with the direct delivery of medical exercise training services to the client. Okay? So whatever you do with that client, whether it's a strengthening program, whether it's a cardiovascular program, they get on a piece of equipment, it's a group program, it's a lifestyle education program, you got to have systems with that. And now you say, well, Dr. Mike, I don't really need a system. Folks, you're not building this for you. You're building this to have additional staff members. And remember, at some point, you're going to want to take a vacation. You're going to need to take time off. You are. Right now, you say, I'm not worried about that, folks. I'll tell you, it's going to come and you need to start thinking about that. So this client management component is one where you have protocols that are going to be followed when a client comes in the door with a certain medical condition. Let's say they have a total hip replacement. What's the protocol that you're using in your facility? Does that protocol also adhere to the equipment that you have in your facility? Okay, so when you look at the idea of client management, this means everything that's related to the direct provision or providing of the services to the client. Now let's talk about medical relationships. Now, folks, for a long time I was in private practice, which meant I had to deal with a lot of physicians. And the thing I learned was physicians are ordinary people that went to medical school. You're probably learning that physical therapists, physicians, chiropractors are ordinary people that went to medical school, which means they have their preferences. Folks, I worked at a large teaching hospital in Washington, D.C. I was director of physical medicine. We had a neurosurgeon that I knew on a first-name basis, went to the guy's house, had dinner a bunch of times. Guy never referred anybody for physical therapy. Never did. But we had a marketing system in place, and every quarter we'd send the physical medicine department would send out letters to all the physicians. So finally, my secretary calls me one day and says, Mike, Dr. So-and-so referred a patient to physical therapy. So next department heads meetings, I'm sitting next to the guy, I'm like, hey, you referred someone to us, what's up? He said, I got tired of getting those crazy letters from you about marketing, and I decided to refer someone, and here's what I asked him. I said, well, why don't you refer people? You've been the chairman of neurosurgery here for years. Here's what he told me. He said, I had a physical therapist when I was a resident countermand an order that I put on a patient's chart. And from that point on, I never cared for physical therapy. What? But wait a minute, folks, think about this. How many of you have ever bought a product from a particular store? It didn't work, you took it back to the store, and they gave you a hassle about returning it. And you said, forget it, I'm done, I'm never coming back here anymore. Same thing. They're ordinary people that went to medical school, or PT school, or chiropractic school. So we talk about medical relationships. We talk about now we've made the initial outreach. The medical professionals refer to client. How do we now deal with him or her? Every medical professional wants things done a different way. We have referral sources here at Medical Fitness Pros that prefer that we text them information or progress reports on clients. We have others that prefer a letter mail. We have a few others that prefer a fax. All of them across the board prefer that it be short and sweet. We had one doctor we sent a fax to that had 2 pages. He was like, hey, don't ever send me a fax again with 2 pages, only 1. Because they're busy. So medical relationships, this is a system whereby you actually determine how you're going to deal with Dr. X compared to Dr. B. And you got to have that someplace. Next, scheduling and billing. Now, this is always a difficult aspect or system for every practitioner. I don't care who you are. Massage therapist, personal trainer, physician, whatever the case is. Scheduling the clients and billing. Clients want to come when they want to come. You don't have openings 24 hours a day, 7 days a week. Then you got to look at the billing, collecting the money. That always makes everybody a little uncomfortable. So we actually have guidelines on systems for scheduling and billing. We even give you some guidelines on what type of software you can use out there for scheduling and billing, and then verifying that the client knows that there's a scheduled time for their next appointment, and they can verify they know it, which means now if they don't show up, now you can implement your policy of your no-show policy, how that works. And even we'll talk about some billing aspects, what type of software you can use to actually bill the clients. Obviously, merchant card services is a big issue for you. So these are all things that are part of this process. Assessment. There is a system for the assessment. And you say, well, Dr. Mike, why should there be a system for the assessment? Client has a condition, we're just going to assess it. Again, this isn't just about you, the solo practitioner. This is about setting up something that's bigger than you, a system where new people can come in and they can just be absorbed into the system and know exactly what's going on. Let me ask you, if you've ever been to the ER at the hospital, yeah, ERs have problems. Medical facilities have problems, but fitness facilities do too. So don't you feel a little bit more comfortable if you know that that ER has been there for maybe 10 years and they've got systems in place, and you feel out of sorts when you kind of are left sitting there, nobody pays attention to you, or the nurse walks in the room and they got the wrong chart, or they tell you the wrong thing. You want to know that there's a system in place. So we have systems in place for the assessment. Based on a client's particular condition, what procedures will be included in the assessment? What forms will be used with the assessment? With those forms, after you've documented everything, what happens to the forms after you've done the documentation? Do you write a narrative and send that out to the doctor? Or do you just simply text the information to the doctor if they prefer that? So these assessment systems here, or the assessment system, has a lot of components in it. And next system is staffing and education. I know a lot of you out there now, and I've heard from you many times, you're like, well, we need to get more people. We're getting more medically based clients. We're getting more referrals. Staffing. Who do you hire? What kind of background should they have before you hire them? Do you hire when you have 2 clients on the waiting list, or 2 weeks worth of clients waiting on the waiting list? What do? And then once you hire them, or before you hire them, what type of education do they have? Which certification carries more weight? Do you say, well, you don't need a certification because you have a degree and you worked as a physical therapy tech? What do? And then what are the continuing education guidelines? Once you get them on your staff, what continuing education do you require, and what continuing education do you provide? You got to have a system for that. Now we get into documentation. Forgive me for banging the screen here. Now we get into documentation. With the documentation, how are you documenting what you did with the client and the assessment? How are you documenting that? And then once you document it, where are you going to store it? That goes back to operations. So what you're starting to realize here is all of these systems kind of all intermesh to produce an outcome for your client, to produce a high standard or proficiency for your facility, and most importantly, it makes the facility very efficient, very profitable, and makes it very popular. You got to have those. Next, marketing. And you say, oh, Mike, we just go out and we talk to doctors. Folks, I'll tell you, here at Medical Fitness Pros, we would go out and talk to doctors. We had to actually figure out a way to get in and talk to the doctors, so we came up with a system for that. And with that system, we even had a step-by-step process. If we got a referral from a physician, what was the first touch? And what I mean by the first touch, what did we do the first time we talked to that physician? What was included in that packet of information that was given? Based on the doctor's or therapist specialization, what was included in that marketing packet when we went out the first time? What was the actual presentation the first time? The second time, how did we follow up as far as sending a progress report? Did we deliver it, hand deliver it? Did we fax it? Did we email it? And that all went back to what we had done as far as developing the medical relationship, but we had to have a systematic process for marketing. not only to the doctor, but also to the non-medical community, to the clients out there that could utilize our services. Obviously, you have to have a website. When the client comes to the website, what are you going to provide for them at the website with the first inquiry? And with that information you're providing on the website, is it fitness-based or is it medical exercise training-based? Which leads me to a very important point. At this point, you're starting to say, oh, Dr. Mike, you kind of got a headache. You're like, hey, I'm just a personal trainer. My metric is how many people I sign up. I just want to work with a few medically based clients. But once you hung out that shingle, medical exercise specialist, more people started coming, didn't they? Yeah. Now you got more people, you got to document, you got to write letters, you got to talk to the doctor. It's getting pretty busy, isn't it? Yeah. Because there are a lot of people out there that need the services. Which leads us to our last system, communication. Now I said these are the non-essentials. We have others, but I just want to talk about these real quick. Communication. This is the one that takes most of this, not all of them, and puts it all together and says, now you got to go out there and talk and communicate and let people know how proficient and professional you are and get them in the door. So your communication, to some degree, is related to your marketing. Your communication is directly related to your documentation of what you did in the assessment and in the actual sessions with the client. Along with that, communication means you're sending this back to the doctor, therapist, or chiropractor, which means we go back to medical relationships. And all of this has to work based on operations because you got computers in the facility, you got to email this information or print it out and mail it. So you can see all of these systems work together. And folks, you're fooling yourself if you're just simply saying, hey, you know what, it's just me, I'll figure this out. Or I'll open my facility, we'll get it working. Folks, I'll tell you, I ended up broke and almost closing my first facility because I thought my skills were enough, my clinical skills were enough. They are not. You've got to have systems in place. Many of you know that I was an Army officer for a period of time. And I went to United States Army Ranger School down in Fort Benning, Georgia. As an officer, when you go, you have an interview when you get there. And I remember I got there, and this is a very arduous school, but I got there as a lieutenant. And I remember the commanding officer I had this interview with one of the officers there that was in the cadre, and he said, when you look at your career, you have to look at it from the standpoint of where do you want to go, but wherever you want to go, you have to look at what do you have to become to get there. Now I know all of you want successful practices. You want to get referrals from doctors, therapists, and chiropractors. You want to have the admiration of your clients. You want to have the respect of your peers. And doing it solo where you don't have any systems in place and it's just you and I'm just doing this by the seat of my pants and off the top of my head, don't work. If you want something that's sustainable from the standpoint of sustainable referrals, sustainable profits, and just allows you at some point to step back and let other people get in there and see the clients, and you can kind of step back and ask yourself, are you working on the business or in the business? You don't want to work in it, you want to work on it. You've got to look at the idea of putting systems in place. Okay, so we're at a crossroads, as I said before, with medical exercise training. There are a lot of knockoffs out there that are telling you, hey, whatever condition the client has, just do these exercises. They're not talking to you about putting all of this together to actually building a practice. Because folks, I'll tell you, we're in a healthcare crisis here in North America. Okay, our Americans, our Canadian friends, our Mexican friends, and around the world, our healthcare systems are buckling under the just duress of chronic conditions, which means we're going to need more medical exercise specialists to manage these clients in conjunction with the medical community. You got to be able to communicate with them. You got to be able to document it. You got to be able to assess it. You've got to relate to them. You've got to have facilities that are operating properly, not as fitness facilities, but as hybrid facilities where you have fitness and you have kind of the medical component working together. You've got to have client management systems so that you get the most effective exercise program you can. You got to schedule and build because you got to keep the whole thing going. You got to have appropriate staff members and you got to market it, which means you got to have a system for all of it. And it can't be a bunch of one-offs. It has to be a system that continually works. So I just wanted to talk about that. Now you're probably saying, well, Dr. Mike, what do you recommend with regard to systems? We covered this in our medical exercise program director workshop and certification, but also we're developing a medical exercise specialist membership-based website. So we can actually provide all of this information to you in a membership site, and you can actually communicate with your colleagues and find out what's going on in Seattle compared to what you're doing in Charleston. see what's going on in Toronto compared to what you're doing in Abilene, Texas. So we're working on that. That will be called Medical Exercise Specialist 360.com. And you'll see that coming along later. But I really wanted to just simply impress upon you the importance of systems. We have systems in medical practices. You've got to have systems in a medical exercise training practice. And I realize you're the Lone Ranger out there. You're probably the only one in your community thinking about medical exercise. How do you do it? It starts with systems. And I'll write more about this in the blog and also on Facebook. And please, if you would, below this, if you have any questions, submit those questions to me, and I'll be glad to answer them as best I can in the dialogue below or in subsequent videos. So all the best to you. Again, it's a Saturday, so have a great remainder of the weekend, and we'll see you next week.